Hi, folks. Welcome back to Ask Sam. And we've got several questions that we're going to go through. It's going to be a short one. And I hope these questions are pertinent to most other people. So we'll go ahead and get started here. The first one is Linda asks, has ValAsta been shown to help regenerate nerves or repair nerve damage? Recently, I have some symptoms that I've not felt in a while. I have had some nerve stabbing pain at the toe, as well as some numb, itchy skin on my foot, where I've not had those sensations in over a year. A little bit of preemption to this question. These are being driven in a lot of cases from cancer cases. And they do see some pain remediation, but then all of a sudden they start getting these little short stabbing pains and maybe some itching. So let me go over some of that. The ValAsta itself does not cause any of these symptoms, but when you take ValAsta and the inflammatory disease state is mitigated or tremendously reduced, that gives time for the body to start healing. So in some cases, for example, in neuropathy, where you have no feeling at all in your legs, all of a sudden you'll get a tingling, numb type of off and on feeling, followed up by increased itching in the area. That itching is a direct result of healing. So let me go through what happens when nerves are damaged. When they're damaged, typically the myelin around the axon is severely attacked from the inflammation, and you get short circuiting. And when that happens, the stress in the cell body itself becomes very stressed and will eventually lead to cell body death. But as the myelin around the axon that carries the electrical signals to the next neuron is disturbed, and in some situations it's eaten completely off. So if this happens in the brain, where amyloid protein builds around the myelin, that's Alzheimer's disease. But in the body, it's typically severe cases is Lou Gehrig's disease or ALS. But in this case here, we have the inflammation is turning off or basically destroying the nerve feelings. So during that dying process, you get these stabbing pains where you get electrical short circuits. They have a tendency to go in and spark other nerves. The electrical signal that exits out of the axon, because the myelin is the insulating material around that wire. So as that's eaten away, you get these stray nerve impulses, and they're transmitted and translated by the brain as pain. Now, when the inflammation is mitigated and the myelin begins to heal itself, you can still feel periodic stabbing pains. But the most prevalent is during the healing process is the itching. And the itching is the nerve cell repairing itself and trying to come back, trying to reconnect. So it's activating other nerves. And there's a very thin line between pain and itch on a nervous criteria. It's just a different degree of damage that's done to the nerve cell or the inflammation around the nerve cell. So as ValAsta reduces the inflammatory disease state, part of the healing process is this periodic pain. It's going to be quite a bit reduced from the pain that you were experiencing prior to ValAsta, but it's still going to be there for anywhere from a few weeks to a couple months. The itching will eventually subside as the nerve begins to heal itself and make those necessary connections and stop with the errant electrical impulses shooting out. Okay, I hope that helps, Linda. Bill asks, how does it help blood pressure? How does ValAsta help neuropathy? So this one's sort of in line with the same thing, but let's deal with the blood pressure first. About 82% of all undiagnosed or indeterminate causes of blood pressure turns out to be caused by a virus called CMV. It's a herpes virus. Cytomegalovirus is the mononucleosis virus. So anyone who's had mononucleosis and is having a difficult time controlling their high blood pressure, one of the things that you should ask your doctor is, since you've got the CMV virus in your body, that virus never leaves you your entire life. It usually lives in the spinal fluid in your back or in the base of your brain. And when your immune system drops, it's why we get shingles, for example. Those viruses will have a tendency to come down the nerve sheath, wrap around the body, and typically it's symmetrical. But with the CMV, causes a, and some viruses do this, COVID does this too, by the way, an angiotensin type of a restriction of the blood vessel. It'll cause the blood vessel to contract. When that does, your blood pressure goes sky high. Typically, it can happen at the capillary level. It can also happen at the aortic level. But it's these viruses that's affecting the angiotensin part of the blood pressure that typically comes from your kidneys, by the way. But so it is inflammatory driven. So those who have or have had mononucleosis or fever blisters or whatever, one of the symptoms the NIH in our research we've been able to find is that one of the ways to reduce your blood pressure is to add an antiviral to your meds. Valtrex, acyclovir, an excellent antiviral, and it does appear that it will reduce your blood pressure if it's caused by these viruses that you've accumulated over your life. The second question here, how does ValAsta help with neuropathy? I spoke about that in the previous slide, but typically the neuropathy is caused by a lack of blood flow, causing inflammation and nerve body death, and you no longer have the feelings or the feelings of numbness, the feelings of tingling. Preferably we can get it resolved at the tingling level. That means that the nerve is still alive, but it's short-circuiting some of the electrical activity. The ValAsta will stop the inflammation that's probably causing that neuropathy. So most people that have been on this see a definite improvement within anywhere from 30 to 60 days after being on this. If the nerve damage is too severe, you probably will not get it all back. So it's sort of a hit and miss. The earlier you get on ValAsta, the sooner or the less damage that's going to be done to those nerve endings. Rochelle asks, I would love to see Sam's opinions on coffee enemas. Do they help? I'm not a big proponent of coffee enemas. There's been no scientific evidence that measures hepatic metabolism as a result of coffee enemas. Zero. So when they talk about using coffee enemas to hyperactivate your liver for the removal of toxins, there's no scientific evidence of that at all. What coffee enemas can do is they can flush your colon out. Also, your colon is typically set up to remove water from your stool. Your nutrients are extracted in your small bowel. The water is extracted in your colon. But when you do a coffee enema, caffeine will cross that barrier, and you can absorb it. What caffeine will do will stimulate peristalsis, cause your colon to go into hyperactivity. So what most people interpret as increased liver detoxification is nothing more than all of the waste rapidly moving through your colon and being expelled. And your body's very good at eliminating waste. There's no reason for coffee enemas unless you're doing a flush for some reason. So I'm not a big proponent of it. There's no scientific evidence to support the use of coffee enemas. It's just a way of getting caffeine stimulants into your body faster. There is no hepatic metabolism increase when you use coffee enemas. It's interpreted because of the increase in bowel movements that you see. Everyone sort of just assumes that that's caused by the liver. It's not. It's caused by the peristalsis of the colon. I hope that helps. Paul asks, I have lung nodules in both lungs. How does ValAsta affect them? I'm on 11 pumps at the present for Parkinson's. Also, my breathing has been affected. I have never been tested for COVID, nor have I taken vaccines. I do not know if the two are related. ValAsta historically has had no effect on breathing other than to reduce the size of cancer tumors. I'm not sure what the lung nodules are. If the lung nodules are inert cysts, they typically are going to be there for a while. So it's hard from this question for me to answer that. The ValAsta will reduce the bronchitis levels, and that's why we see such an effect with COVID in mitigating or minimizing the effects, the inflammatory effects from COVID. Very few people on ValAsta have ever even been into the hospital because their symptoms have not been that severe. So when you talk about lung nodules, if it's cancer, then the ValAsta should kill the cancer, and you'll end up with these little scars, little nodules that will calcify, and they will reside in your lung probably for the rest of your life. But I'm very interested in to know if your Parkinson's symptoms have decreased dramatically, which they should have. Let's see, what do we have next? Jennifer asks, how does ValAsta reduce the risk of osteoporosis and calcium loss? Typically, it's an inflammatory response. Osteoarthritis is one, but as primarily in women, but men go through this too. They'll start suffering bone loss from a loss of glutathione and an increase in their inflammatory disease state. So the C-reactive protein, again, should be measuring this. And it's almost 1 for 1. If I take ValAsta and reduce inflammation, my risk of osteoporosis goes down dramatically. So the key is to eliminate the inflammation that's causing that problem, and moving that inflammatory risk to an entirely different low level, and the osteoporosis should stop. Now, calcium loss is usually measured in the blood work by a blood test called alkaline phosphatase, and that number in normal people should be less than 120. It is a very important test to run. If that number is greater than 120, alkaline phosphatase, calcium is an alkalate. It's in the alkaline part of the periodic chart, and alkaline phosphatase is primarily calcium phosphate that we're measuring for. Calcium phosphate accumulates and makes our bone structure. So if we have something that is inflammatory, that's dissolving our bones, cancer will do this also if it resides in the bones. That calcium ends up in your bloodstream as calcium phosphate, and then the blood test that they tests for that. So if you see elevated levels of alkaline phosphatase above 120, it's an indication that you're losing bone. So two reasons for losing bone. One is inflammatory, the other one is cancer. So you want to get those checked very, very quickly and get that number back down again. The ValAsta will do two things. It will reduce the alkaline phosphate number. It will also reduce your C-reactive protein and your inflammatory disease state. Bob asks, does, I guess, ValAsta have seaweed or iodine in the product? The answer is no. ValAsta is not a seaweed. It's actually an algae. It's a single-celled organism. It's not shellfish or anything like that. Even the iodine myth about shellfish having high concentrations of iodine, that's typically not what it is. The whole iodine story probably is more myth than it is truth. Shellfish has about 35 micrograms of per serving of iodine, which is well below your daily intake strictly from vegetables or fruits or meat. The one thing that does pose a little bit of a problem is that when shrimp and seafood are harvested in the ocean, the ships go out for about 3 days. So what they'll do is they'll spray iodine water inside the coolers that are storing all the shrimp for those 3 days to keep biological growth from happening and creating a decomposition of protein that gives you that fish odor. So they'll spray iodine on it. That's where the iodine is coming from. It's not necessarily coming from the seafood. People can, about 3% of the population can have an allergic reaction to seafood, but it has nothing to do with iodine. It has to do with a protein that's actually contained in the seafood itself. It's an allergen, and I don't recall the name of it right now, but I'll be able to provide that if someone has interest in it. But overall, ValAsta is not derived from seaweed, and it does not contain iodine. So with that, I'm going to close. Please continue sending in your questions, and we'll probably take a break next week. I'm going to be out of pocket, but the following week we'll take those questions and do another video. Thank you, folks, and keep them coming in.